lockdown in the world pretty early on, back in March. What's your take?
So, Cynthia, you know that most countries who actually went through very severe lockdowns, when they did open up, the kind of precautions and the kind of strategies taken were not adequate enough to really deal with an open environment, where, of course, we've seen surges taking place almost all over the world. And India is no exception. So India basically expected to see that the lockdown had served a certain purpose, but I don't think they had anticipated that post the lockdown, gatherings and other such kind of events and activities would actually infect people at the scale that it did. And therefore, from having a very small percentage of the population infected during the lockdown, it now has surged over 7 million infected cases. The only sort of silver lining is that the actual active infective cases are just over 1 million. So you can see that 6 out of the 7 million cases have actually recovered. So that's the kind of tiny blessing that we can count. But having said that, we know that sero surveillance has actually indicated that 1 in 15 Indians are probably infected or have been infected with the coronavirus, which is also something that's reflective of what it says in the world, where they reckon that 10% have actually been infected with the virus.
Kiran, we're still seeing and trying to understand this pandemic and virus. If you take a look at the experience of India, what could have done to avert this blowout?
So, let me put it this way. I think India, basically, like any other country, needed to do a lot of preparation before it lifted the lockdown. In many parts of the country, we have done something quite sensibly, which is to basically put a restriction on the opening up of, large public spaces, public gatherings. Even right now, they're talking about, not encouraging large religious festivals and gatherings as a result of that. A large, of course, movie halls, malls, and many of these public spaces have not been allowed to open up in most parts of the country. But having said that, you will understand and agree that livelihoods are very important for any country. I think economic lockdown is something which we just can't afford as a country or as an economy. And I think people need to get back to their livelihoods. So while lives are important, I think livelihoods are equally important. So I just don't think we have a choice but to open up. But I think what is extremely important is to make sure that we have a very strong vigil on testing, tracing, and of course, social distancing and masking. I think these are very, very important and critical. And I think many of us who are in this field of biotech and pharma, I think we have seen that aggressive testing does help. It does bring down and reduce the test positivity rates. We have seen it in our own campuses, where it started with a 10% test positivity rate and it's down below 2%. So you've got to do very aggressive testing and containment. So I think there are very good scientific models available of random testing, of targeted testing, and to make sure that you contain and quarantine those hotspots. I think those worked very well during the lockdown, and we needed to have done that post the lockdown as well.
I'll pick up on the testing slightly later. You talked about appreciating the fact that economies need to open up. But I think the fear really is, as you open up, of the virus getting out of control again. We're seeing it in Italy. Paris going under a curfew along with 8 other cities. Germany tightening regulations. There is that risk. Do you think India is ready for this reopening, for people to go back to the cinemas, for schools to also start opening from today?
Well, let's put it this way. While some of these need not open up, I think businesses have to open up, factories have to open up. And so once you do that, you are going to invite infections. And I think what we need to do is to make sure that we actually aggressively test and aggressively contain. I think we've shown that this is possible in at least the corporate world, in many of our campuses, but we need to scale it up. I don't think India can afford to now backtrack and get back into a lockdown. It's too late. And I think many countries will find that even though they've started reintroducing restrictions, I think they ought to do a little more than just the restrictions. I think they ought to look at scientific models of containment and testing and tracing, because that's what they've forgotten to do.
So here's capacity to test.
Well, there are multiple ways of testing. So, for instance, whilst RT-PCR testing is the gold standard, there is also something called pool testing, where you can basically test 5 persons at a time in a pooled manner. And this can actually go up to a much higher level if you make the sensitivity of those tests better. So you could actually scale up testing tenfold if you really worked on it. And then if you combine that with rapid antigen tests and you start validating the kind of sensitivity, ratios between rapid antigen tests and RT-PCR tests, there are various ways of testing and making sure that you can actually test at scale. But I think we've got too lost in testing the way we did at the start of the pandemic. And now we need to move to another scale. And I think that's what countries need to do. Because this pandemic is not going away in a hurry. You do need to test. You need to treat properly, because I think that's another thing that we need to focus on. We have understood the disease better. We know that there are 2 phases of the disease. Most people only get affected by the first phase. And the others who get affected by the second phase, they are the ones who are vulnerable to fatality. And that's where you need to make sure that you understand the treatment protocols and make sure that you catch it before it gets into a complication from which you can't rescue those patients. So I think there are a number of scientific strategies that one needs to adopt. But I think we're going about it in an ad hoc manner. We are going about it in a manner where opinions count and science is not being looked at rationally.
Kiran, give us a sense of where India is in this fight against the pandemic. Has India turned the corner? Are you confident of that?
We still can't say that, because for the simple reason, when you sort of start tracking the numbers who are infected on a daily basis, and you suddenly see for a few days the numbers declining, and you feel that you're beginning to see a flattening of the curve. Unfortunately, a few days later, you again see a surge. So I don't think we're in a safe place as yet. For me, personally, the way I look at it is, yes, a large number of people are getting infected, but certainly the case fatality rate is reducing, which actually gives me some hope that we are treating better, that we are learning to manage the disease better. And that's what countries need to do. If you can bring down your death rates to near 0, I think we are in a much safer place than today. Today, I think the big scare is that the moment people get infected, you're not sure how many of them will succumb. That is really the scary bit.
Let's pick up on that. Why do you think India has managed to keep the death rate low?
Well, I think we have a young population, and as data has shown us the world over, younger people are able to recover from the virus much faster and better than older of comorbidities. We've also clearly seen that a large number of people who succumb do have comorbidities. And I think when you combine age and comorbidities, and you combine immunocompromised people with, or even people with the poorer immune systems with comorbidities, they are the ones who really don't, make it through the disease. But by and large, if you look at India's statistics, out of probably about 7.5 million, almost 6.5 million people have recovered, and it's about 1.5 or one little over 1 million people who are regarded as active cases. And then we've had about 110,000 or thereabouts the number of fatalities. So if you look at it in perspective of a country of India's size, I think that gives you some comfort that it's not such a deadly disease as it is perceived to be. But certainly many other countries have not been that fortunate. I think they've had a very serious impact of the virus. But having said that, I think what really concerns all of us is that this pandemic has had a huge impact on the economy. And I think people are still not out of the woods. People are very fearful of the disease, and it's not business as usual. So I think that is really the worry.
Are you concerned that winter is coming? Talk about how surgeons of the virus in winter.
Well, I think many parts of the world are very concerned about that. I think many parts of the world are very worried about the second wave that is already becoming visible in Europe and many parts of the world. As far as India is concerned, we have gone through the monsoons, and I think we've seen the surge during the monsoons. I don't think India has the same impact of the winter that other countries have. But having said that, there are parts of northern India that need to worry about the impact of winter. But what I would really like to focus on is to have a far more structured approach to diagnosing early, to treating early, to tracing early, and to containing very early in the day. And I think if you keep doing that, I think by the time the vaccine arrives, you will be in a much safer place.
How do we get to that structured approach? I mean, how do you view as the role of the government in ensuring that?
Well, that's $1 million question. I think governments have to get it right. I think you have to get, a very strong group of people who are epidemiologists, scientists, and statisticians who really, and digital experts to really, work out these models. I know for a fact that in our own state of Karnataka, in Bangalore, many of us in the corporate world got together. We used technology very intelligently to see how you can do some of this. But it's never easy to get governments to adopt many of these practices. So we keep adopting it in the workplace, and it works very well.
Kiran, before the next question, I'd like to bring up this polling question for us and listening to this conversation. The question is lining up the first stock of vaccines when they become countries at vaccine nationalism? A, yes. B, no. Just two choices. Should countries vaccine nationalism? So far, we have about 20%, 7% are now edging upwards, about 30% saying yes. We have 73 currently saying no. And I understand for you, you feel that countries should not adopt vaccine nationalism. Why not safeguard your national interests, Kiran?
The way I look at it is that this is a global pandemic. We are all in it together. We need to be a collective force, a collective effort in basically dealing with this pandemic. By being nationalistic and just making sure that your populations are vaccinated doesn't protect country that may not be vaccinated. I think we have to go about the availability of a way that makes sure that the interests of the populations, and make sure roll out vaccines in a very well thought out way. And I think this is not what is happening today. I think countries are becoming very sort of self-centered. They're not they I mean, the pandemic has shown you that it doesn't matter where you are, you can be infected despite being a rich or a poor country, despite having the best healthcare system or the worst healthcare system. I think the virus doesn't distinguish or know borders. So I think from that point of view, we need to make sure that we go about it in a strategic way that deals with the rollout of the vaccine across the world in a way that protects the most vulnerable parts of our populations, and also deals with those who are frontline workers who are actually facing the virus much more than others.
That is the ideal situation, Kiran. Realistically, the richer countries getting access to the vaccines first before the poorer countries, is that how it's likely to play out?
Well, unfortunately, it is likely to play out in an unfair way. Of course, I do commend COVAX, because I think COVAX is trying to make sure that LMIC countries get access to vaccines almost simultaneously. And I'm glad that a large number of countries have signed up for the COVAX initiative. Over 170 countries have signed up till now. And I hope that through that effort, at least the poorer parts of the world will get access to those vaccines as and when they roll
out. We had Serum Institute's Nawala recently saying that India will need 11 billion and distribute the vaccine to the nation. That amount itself sounds pretty challenging.
So yes, India has a daunting challenge because it has such a huge population. But having said that, India is also fortunate that it has the world's largest vaccine capacity. And fortunately, India is already, collaborating and doing vaccine development on its own. So hopefully we will have a large, capacity and a volume of vaccines available for deployment in India, and as well as exporting vaccines to other parts of the world. So from that point of view, I think what we need to do is to really plan the deployment of vaccines very well, because, for a country like India, the biggest challenge is going to be the cold chain logistics. We've done it very well for the polio vaccine, but that has been done over an extended period of time. Now we have this daunting challenge of rolling out a vaccine in a very short period of time and at scale. So how are we going to do that? And I think that is what India needs to look at. And I think India has a unique opportunity of using digital technologies to create that database of vaccination, which I think is going to be very, that you're not going to just have one vaccine. You are likely to have to track each one of those vaccines, since we are developing them in such is extremely important. India is the only country that has this unique identification number at such massive scale. If we can link that to the vaccine, it will create a very, very efficient deployment of vaccines, so that in the future, if we are seeing that events of a particular vaccine, you can quickly track down those people and see whether they are suffering from those same adverse events or not. Equally, that many of these vaccines require a second booster dose. So to ensure that the people who are vaccinated have indeed received their 2 doses is also going to be very important. And without digital technologies to track every single Indian who has taken a vaccine and makes sure that they've done it in a compliant way, is going to need digital technology.
Kiran, this is the question. How soon do you see an approved vaccine being available to Indians?
As you know, many countries are trying to come up with emergency. And I think this is what I think is the likely scenario, that by the end of the year or maybe in January, you're likely to see at least a few emergency use authorizations being issued by various regulators, including the Indian regulator. This will mean that you will have access to the vaccine in small quantities, but I think it's likely to ramp up very rapidly in the months ahead. And I think by the middle of next year, you should have vaccines available in a reliable way at scale.
Are you concerned that we could be into the market without enough safety data?
Well, I think that is a concern because, Sindha, as you know, that for instance, you are not years durability of response. These vaccines are going to be approved in a very abbreviated phase. And I think this means that we just don't have enough data. All that you're measuring right now is an immune durable that response. So would you need to vaccinate yourself here or others? Available to us, and unfortunately is at this point. We will need durability data. All we can say data in terms and what the approvals are.
I just want to from a participant to do with India is the best in a country that populates.
So I didn't get the last part of your question, because you said what in a country like
that doesn't really have apart from inward.
No, I think meant because getting into a state of preparedness, there is a, and I think this is also levels. So getting into a prepared exercise that by we will to say that we and that and I we must use a digital platform vaccines like mentioned.
Kiran, in a better pandemic in terms of hospital treatment in case increase in active cases in the sense of all these aspects?
Unfortunately, the answer is no, because if things get worse, we simply don't have the capacity to deal with with the large numbers of people who might land up in hospitals. I think as far as testing is concerned, obviously we need to ramp up our testing if that happens. Right now, we're just dealing efficiently with symptomatic cases. And I think all that is happening because our indigenous industry has, I must say, both with are using rapid antigen PCR tests, as I mentioned, helping to sort of tests by pool testing. So I think some parts of the country are better way than other parts of the country. Not in a stage where you can say that we are testing. Certainly not. The so challenge is that manageable at this point in time. But if the active cases start surging, then we simply don't have the capacity to deal with it.
Kiran, this question has to do with the education policy. Will India's new education policy produce more vocational people, giving companies more employable graduates who don't need expensive additional training?
Look, any new education policy takes time before you actually see the impact and the effect of that policy. I don't think that we can really rely on quick results. This is going to take time, but I think the new education policy has spelled out some new ways of educating our people, new ways of skilling people. I think they're talking about project-based learning, apprentice-based learning, and all that augurs very well for the education of the future. I think online education has also become a very important part of our education system today. But as you know, these are early days. We will need to understand how online education, hybrid education models are really going to create the kind of employable human resources that we want. At the moment, in corporate, the corporate scenario, I think a lot of these training programs are benefiting from online courses, and I think AI models and data analytics is giving us an understanding of how people are learning. But these are early days, and I really believe we need to evolve these new educational models over a time of at least 5 to 10 years before you can be confident to say that, yes, it's going to give us the kind of people that each sector needs.
Kiran, I can't speak to you without asking you about the Indian economy. What do you deem as the prospects, the outlook for the Indian economy, given that it's heading towards its worst contraction this financial year?
Yes, I think, this year is a very challenging year. And yes, as it's been forecast, our economy is likely to shrink by 10%. But having said that, I think we do need to really look at the economic opportunities that India has. This pandemic actually has unleashed a huge potential for India. The agricultural sector actually has started performing very well, and we need to get into value-added agriculture. I, for one, believe that entrepreneurship is something that ought to be, amplified as much as possible. And I think we are seeing this happen at this pandemic time, because a large number of new opportunities have arisen, especially in this COVID world, this virtual world, where there are so many new services that have emanated. The digital world has also created a large number of opportunities. I think regulations that prevented a lot of these businesses have been forced to accept that telehealth, telemedicine, e-pharmacies, online retail, and everything that goes with the digital world, which was not being allowed by the regulators, has forcibly been accepted. So I think there are new kinds of job opportunities that India has created. So when India has always been talking about this huge market that India is, which people felt that wasn't a very attractive market, I think we can create that market. And then I think a large number of Indian companies have been forced to think about being globally competitive from an export point of view. And I think this is another big opportunity. So whether it's, the pharma industry, which of course has always been a very export-oriented industry, I think the other industrial sectors, the engineering sectors, and the textile sectors and what have you, I think there are a large number of opportunities. If we play our policies well, I think we can actually revive our economy in a very robust manner, and we have to be forward thinking. I think we get very trapped in draconian policies which need to really be looked at in a very different way. I think ease of business is something we have to look at, and we have to become much more competitive in terms of getting businesses to be more efficient because of removing half the regulations that stifle it.
Is the government doing enough, though, Kiran? I mean, so I guess I expect that the government can do more in terms of fiscal stimulus.
I really don't think we need fiscal stimuli more than what has been given right now, because I really think just easing regulations will give you the necessary stimulus that you need to run your industries and businesses more proficiently and to actually generate more cash in the system. I think today the regulations are making it financially very challenging. And I think removing half of them will actually give you the fiscal stimulus in a very different way that will actually create a very robust economy.
Earlier we heard from Mr. Jashankar talking about supply chains. We know there's been a lot of disruption in the global supply chain, and countries in Southeast Asia has in fact benefited from how companies have moved out of China to find alternatives to diversify. There's a lot of talk that India could benefit the most from this. What's your take on that?
India definitely can benefit a lot from these shifting global supply chains. But as you know, when supply chains shift, they're looking for a plug and play model. And I think India does not have the infrastructure for that plug and play model as yet. But if we start investing and creating those infrastructure needs for a plug and play model, I think we can get a large part of that share.
When can that happen, Kiran?
It's anybody's guess. It can happen as soon as the next few years, or it can never happen because we don't do those right investments. But I think it will happen in many parts of the country, because I think there are certain parts of the country who are very, very aware of this opportunity and are investing to make sure that they don't miss the bus.
And would Modi's Made in India initiative towards that?
Look, I think, the Make in India, Made in India opportunity that we are all looking at is really about being globally competitive. And in order to be globally competitive, we need a lot more than just making something in India. We need to make sure that we have the skills, we have the infrastructure, and we have the products and services that the world needs. And I think based on that, I think this can be a huge, huge opportunity for India. I certainly believe Prime Minister Modi's Made in India and Make in India agenda can be very well served if we make these right investments.
Kiran, I'd like to go back to another question from one of our participants, and this goes back to COVID-19. What are the steps we need to take to not get COVID-19 in the Indian context where population density is so high in cities?
Look, first and foremost, I think we need to ensure that we identify outbreaks faster. We need to identify and test dense populations in a much better way. The only way you can avoid being infected is to protect yourself. I think it is, you need to make sure you go to gatherings, you avoid these dense kind of places where you are likely to get an infection. And you also mask yourself and keep that safe distance that everyone keeps talking about. I myself got COVID, so I can't be the one to tell you how you can protect yourself. But the one thing that I did learn from my own experience was that the sooner you diagnose yourself, the easier it is to treat and the easier it is to recover.
There's a lot of concern about complacency and how perhaps social distancing and peak is beginning to seep through. What's the risk of that, Kiran?
Look, it's very difficult for young people to socially distance, okay? And I think the only thing they can do is to mask up, because masking does reduce infection. And let me also say one more thing to people who are a bit skeptical about masking, that even if it doesn't completely stop it, the viral load that will be transmitted if you have a mask is very low. And we all know that when you have a low viral load, you can recover very fast. I think what really is the problem is people who get a high viral load and who basically also have comorbidities or who have very severe symptoms and are not taking any action.
Talk to us about the latest of itolizumab. I hope I'm pronouncing it right. It is in its last stage of testing.
Yeah. So this is a product which is, as you know, I mentioned that there are two phases of the disease. The first phase is just a viral phase, and you need to use antivirals to get rid of the virus. And most people actually recover from that first phase. But what the virus also does is to elicit a very strong hyperimmune response. And that hyperimmune response is abnormal. And what it does is that it basically starts getting a large number of what we call cytokines released into the body to fight the virus. And unfortunately, there's such an overproduction of cytokines that it actually has a very nasty, almost fatal effect in many cases, because these cytokines can actually act against your own organs, and you can end up with organ failure. And so a large number of deaths have been associated with what they call as a cytokine release syndrome, which needs to be prevented or treated or even stopped if you can. And what our drug does is that it works in this particular signaling pathway, and it stops signaling the production of cytokines. And by doing that, it actually then rescues the patients. And if you do it early enough, it even prevents the cytokine release syndrome. So we did a small proof of concept study with this drug, which actually is used for autoimmune diseases, which actually elicits the same kind of response. And by doing that, we found that the patients who took the drug did very well, and those who didn't take the drug had a much longer kind of recovery process, and some of them also died. So I think we are now trying to do this at a much larger global scale, and we will license this drug for other applications to a US company. So they are about to start a COVID trial in the US and Latin America to basically use it in a much bigger way.
Of course, the final question is
India, of course, we are using it.
What's the progress on Biocon Biologics?
Well, Biocon Biologics, as you know, is one of the frontier biosimilars company, and we've been very successful in developing a pipeline of biosimilars, which, as you know, is the next big opportunity in the pharma world after generics. And these biosimilars actually are going to sharply bring down the healthcare costs by reducing the cost of these very expensive biologics. And we as a company have got a global play. And I think along with our partner, Mylan, we have actually entered into many of these global markets very successfully. And this is a business that we believe is going to be a very large business opportunity for Biocon. And we intend to unlock value from this business in the next few years through hopefully an IPO.
It's even likely that question, Kiran. Kiran Mazumdar-Shaw, we thank you so much for your time today. You've been so generous.
Thank you so much. Thank you so much.